STEAM Series, championed by your Southern California Toyota dealers.
All right, guess what, folks? It is time for this week's STEAM Series.
CBS 2 meteorologist Danielle Gersh is introducing us to the COVID-19 line team director.
And today our focus is science and math. After decades meticulously repairing hearts in fragile babies, COVID took this surgeon to a new frontier. From early in childhood to the darkest days of the COVID-19 pandemic,
I can never remember not wanting to be a doctor.
Dr. Evan Zahn is a pediatric interventional cardiologist at Cedars-Sinai Medical Center. His specialty, fragile infants born with heart problems.
Anything as simple as a hole between the two pumping chambers or a valve that might not work, to only having half a heart, literally one half didn't develop. We call our patients snowflakes. Every patient is different, and taking care of small humans, sometimes as small as 1 pound, presents tremendous obstacles when you're trying to operate.
When he set out to take care of tiny hearts more than 30 years ago, Dr. Zahn never anticipated he'd be working the front lines of this global pandemic. When COVID hit LA last February, many pediatric surgeries were placed on hold. So
I reached out to the head of the Heart Institute and just asked him if there was anything somebody with my skill set could do. I'm pretty good with my hands.
Decades of practice navigating tiny wires and scopes were just what his critical care colleagues needed.
These COVID patients, a significant amount of them were going to need ICU care, which means a significant amount were going to need these central lines.
Dr. Zahn is now director of his hospital's COVID-19 line team.
A highly skilled, experienced group of people who could be called at a moment's notice to the sickest of the sick COVID patients and put in the lines, the catheters that they need to help with their survival.
Members of the COVID line team can find a vein in a flash when a patient is on a ventilator.
You need a big catheter that goes pretty much directly into your heart to give all your medicines. You need a little catheter that goes in one of your arteries to measure your blood pressure every second.
Of all the STEAM disciplines, working inside veins and arteries relies most on science and art.
There's definitely a feeling.
And a preemie with a heart problem.
We use wires that are 14 thousandths of an inch, and you need to feel what that feels like bumping up against the inside of a tiny baby's heart, and when it does, what kind of turn or angle or the different things we do.
When Dr. Zahn and his team offered to transfer into the ICU to help fight COVID, they knew
that we'd be exposing ourselves, but we'd be as safe as we could.
While he can't wait until COVID is behind us, his advice to anyone at a crossroad: choose the path most likely to make your future self proud.
This is the battle for LA, and we're part of it, and we're helping.